Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovello, and I am here today with my wonderful, non-embarrassed colleague, Dr. J. Calvert.
I'm a little embarrassed.
Did I embarrass you?
A little bit. Just, I don't think I'm a necrose, but I'm a little embarrassed today.
We're just nerding out over our last podcast where we talked about embarrassed blood vessels, but no one's embarrassed today.
No,
we're all super happy and glad
totally
to be
perfused.
Here. Totally well perfused. And here today to talk about a subject very near and dear to my heart and to everyone's hearts, really, the IMF, otherwise known as the inframammary fold.
Yes, the inframammary fold. It is a structure that you need to understand in terms of breast surgery that's very important.
It's super important. It is that actual distinct line that separates the bottom of the breast from the abdomen. And it's there in men, a little bit less defined, and it's there in women. It's there in everybody. And it is a very, very real structure. And I say that because I have to say that because I remember when I was going through general surgery, I would have attendings taking me through mastectomies, and they would just blow through the IMF, and they would even say, it's not a real thing. It's not an actual structure. And I had one surgeon who was very particular, and he took me through a mastectomy really carefully, and he said, look right there. It is a real structure, and you could see it. You can see it. It's very obvious. And it's a collection or condension. Condension, is that a word?
Condensation.
Condensation?
I don't know.
I know what I'm trying to say.
It's a coagulation. It's a coagulation. No, it's a confluence.
Confluence of fibrous bands that go from the undersurface of the skin down to the chest wall. And it pulls that skin in down to the chest wall. And it is the defining border of the bottom of the breast. And you have to respect it. I have a lot of respect for the IMF. Hands down.
And you don't want to embarrass it either.
I do not want that IMF embarrassed.
You do not want to embarrass the IMF. So not only is it a structure, but histologically, which means on sectioning, on looking on the microscope, it's very clear that the IMF is a very real thing.
Very real thing.
Yeah.
And it's important when you're doing breast surgery, reconstructive breast, cosmetic breast, because that structure serves many functions, really. But let's kind of go through the different surgeries where we have to address it. The first one is sort of the most obvious, and that's an implant surgery. So when you're doing an implant-based surgery, whether it's reconstruction or cosmetic implants, you need that IMF to be in a solid position. Every once in a while, after a mastectomy, the mastectomy surgeon's blown through the IMF and it's non-existent. I have to repair it. I put it back on just about everybody.
You have to make a new one.
Because otherwise, that tissue expander or that implant is going to sort of fall down towards the abdomen. There's not going to be a distinct cutoff. It's going to have this sort of blunted, obtuse angle as opposed to a nice crisp angle. And it just doesn't look like a breast. So you have to put it back when it's been destroyed. The other thing is when you're putting in a cosmetic implant, sometimes during the dissection, the IMF will be released unintentionally. You have to put it back together because if you don't, that will be what causes what we call a double bubble deformity, where the implant slides below the IMF, but the IMF kind of retains its memory, and so it shows up as a dent across the bottom portion of the implant, where most of the implant's above it, and then there's like this bubble below it, and that's called a double bubble deformity, and it's not cute.
I was going to say, you know what else it's called? Time for some revision surgery.
Time for revision surgery.
Because you cannot, it's as you said, it's not cute.
It is not cute, and patients,
they don't like it.
They hate it. And sometimes it's not so obvious as a double bubble. Sometimes it's just more that the implant kind of slides down the chest wall a little bit and just doesn't maybe sit in the same position as the opposite side. But it's because that IMF has been, weakened or destroyed in some way. So like I said, have a lot of respect for the IMF during implant surgery. If in any way I think it's weakened, compromised, I repair it, I put it back where it belongs.